And then can you bend forward just like this, like you're gonna touch your toes? There you go. Now we're talking. Perfect.
Because now he's going to use his fancy.
The super fancy level. Okay, you can come all the way back up. Nice work. That was great. My mom was an operating room nurse and my dad was an orthopedic surgeon. And so I got to see the things that they did growing up. And that was a wonderful example. It also let me see the satisfaction that you can get from helping people. I tried really hard not to go into pediatric orthopedics because I wanted to do my own thing. But then the more time that I would spend with orthopedics, the more appealing that was. That helped me to confirm that this is something that I love doing for all the right reasons and really solidified my interest in it. I'm Craig Birch, one of the orthopedic surgeons in the spine division at Boston Children's Hospital. I think you're gonna be super ready for today.
Yes.
And then you just get to snooze through the whole thing. For you, it'll feel like 2 seconds. You'll go to sleep, wake up, and you'll be like, are you ever gonna start? But it's done. My role in the orthopedic department is really just, if there is an issue with the spine, is to help take care of that, whether that's with a brace or if it's with watching or with some type of surgery to help correct a deformity or an injury. The most common things are scoliosis or a side-to-side curve in the spine, but sometimes we'll also see different situations where the spine developed a little bit differently when kids were growing, or a stress fracture of the spine. I like to make sure that the kid understands what's happening. Maybe they're not excited about a brace for their spine, but if they can understand why we're doing it, then usually it's easier for them to accept. And so sometimes that takes extra time, but I think it's worth it in the long run. Lengthwise, like you're kind of slow, steady, plugging away, and then you had a big jump over this last year. So you're jumping up and keep getting taller and taller. And so we always want to look towards the future and see what is around the bend and how we can improve life for the patients that we're taking care of. Technology is certainly at a point where it's going to allow us to be even better whenever we're doing surgery. And I think some of that is what is the implant that we have, or what screws exist, rods, how do we put them in and how do we do it the safest. And then I think there's the whole other side of using technology to then be able to avoid ever having to do surgery. If we can make better braces that are more effective, the technology is going to have a really big impact. My ultimate hope is that they're able to do the things that they want to do in life and not feel limited because of their back. And I think there's lots of different ways that we can work together to try and accomplish that. Most of the time kids come in and they want to be active and they want to be doing things, and we're able to do something that helps them get back to doing the things that they love doing.